Good morning, viewer. Welcome to our Active English First Year's Amazing News. Yeah, a new study from the Lundquist Institute for Biomedical Innovation at Harvard UCLA Medical Center in collaboration with researchers from multiple institutions challenges the long-standing belief that high cholesterol directly causes coronary artery disease in metabolically healthy individuals. Published in the Journal of the American College of Cardiology Advances, the study examined 100 metabolically healthy adults who had followed a long-term low carbohydrate ketogenic diet and developed elevated levels of LDL cholesterol. These individuals, known as lean mass hyper-responders, were found to have high LDL-C and ABOB levels without evidence of baseline coronary artery disease or disease progression over time. The findings suggest that in this specific population, traditional cholesterol markers may not predict heart disease risks as previously assumed. The authors emphasize the need for further research and a more personalized approach to cardiovascular risk assessment and treatment. Cardiovascular disease is the world's leading cause of death, making diagnosis and risk assessment a high priority. The prevailing theory of cardiovascular disease risk is the lipid hypothesis, which posits that elevation in apolipoprotein B, ApoB, and low density lipoprotein cholesterol LDL-C are significant risk factors that should be primary treatment targets. However, this new research questions the relevance of the lipid hypothesis in metabolically healthy individuals whose cholesterol levels rise in response to low carb ketogenic diet, often adopted to address significant mental or physical health challenges. As evidence accumulates for the efficacy of therapeutic carbohydrate reductions to improve chronic conditions ranging from diabetes or inflammatory bowel disease to bipolar disorder, investigating the cardiovascular risks of diet-induced high cholesterol is become increasingly critical despite the striking beneficial effects that are seen following this therapy. Adoption is often discouraged by medical doctors because of the presumed increased risk of heart disease. The study investigated the relationship between LDL-C, I beg your pardon, APOB, and heart plaque progression in a subpopulation of people who adapt low carbohydrate diets and fit the LMHR phenotype. And this unique metabolic profile includes elevated LDL-C and ApoB levels despite otherwise healthy metabolic marker levels including low triglyceride, high HDL, low blood pressure, low insulin resistance, and low body mass index. The researchers found no association between the plaque progression and total exposure to changes in or baseline levels of ApoB and LDL-C. Rather, baseline plaque burden was identified as the strongest predictor of future plaque progression. These findings suggest that the high cholesterol is not always a marker of cardiovascular plaque progression and that individuals with the LMHR phenotype may benefit from cardiac imaging to further assess their cardiovascular risks. Behind this exclusive report, FTV English, Delhi, Bharat.